Technology can transform healthcare in Africa, offering a brighter future for everyone. Africa 54 technology correspondent Paul Ndiho is here to tell us more. Hello, Paul.
Thanks, Esther. Rivia, an asset-light healthcare chain in Ghana, is partnering with existing clinics to enhance patient care quality by leveraging technology and creating solutions to reduce emergency room overcrowding. I spoke with Isidore, the CEO of Rivia, about the company's network of primary healthcare clinics.
Last year, I was in the clinic to treat an ear infection. I was having a terrible ear infection, so I went to the clinic. When I got to the clinic, I wanted to return because of the state of the facility. The walls were very dilapidated. And this was in Accra, Ghana, by the way. I saw papers all over the place, and I knew for sure that I was not going to receive quality treatment in that facility. You see, the state of infrastructure is not just, it's not the sole indicator of the quality of care that one would receive, but in this part of the world, that is the thing you see the most. The first impression counts the same. So, I went ahead to have my treatment, my ear treatment, infection treatment in that facility. But then I was very curious to understand if the many primary care facilities we have in Accra were in a similar state. And to my shock, over 90% were in a similar state. Then I was no surprised why many people did not have trust in Africa's healthcare system. So we embarked on a journey to transform that narrative. We decided that we would partner with existing facilities. So the goal is to build a network of primary care clinics offering high-quality doctor consultations, lab services, and medications, virtually and in person.
How are you able to do this? Where are you getting the funds to scale very fast? As I see you've also, you're trying to acquire some new places. What does it take to do that?
Great. We have 6 clinics today. We have moved the quality of care from the average 2.8% over 5 to 4.4 for Rivia clinics. People want value for their money. And given that what we are providing offers greater value at the same price, that's really important. Offering value without inflating the price, and we're able to offer that. And they are super excited. There is intense pressure on us to scale the service to multiple locations in Accra and even beyond Ghana.
There are a lot of people who think that, for example, the healthcare industry has, let's say, it has the skill set it needs. But in some cases, the doctors, the nurses, the pharmacists don't have the tools they need to do their jobs. You are now in this space. What's your take?
I have seen that firsthand. Africa does not have a lack of qualified healthcare professionals. Some of the doctors operating in the other health systems we are running to, like in the UK, whereas in America, are the same African doctors who were trained on the African continent, are the same nurses who were trained on the African continent. So if you go to the UK today, you see a lot of African nurses, right? You go to America today, you see a lot of American doctors. So
yeah, my dentist, my family physician, they're all from West Africa. One is Nigerian, another one is Ghanaian.
You see that? So the problem is not a skill problem. We cannot address this in an isolated manner. We need to work as an ecosystem, from government to the private sector, and agree that we have a crisis. Lack of tools, lack of diagnostic devices, machines, is affecting the quality of treatment. Without diagnostics, doctors cannot treat patients. And Africa's finance budgets, only 1% of Africa's finance budget is finance and diagnostics equipment on the continent. Only 1%, right? And so we need to take a systemic approach, an ecosystem approach, to addressing, the lack of equipment in the industry.
Tell me something about the clinics that you have partnered with. What do they need for them to be partners with you?
So there's a business model requirement, which is that the clinic must be located in an area that is accessible the clinic itself must be willing to accept the standards that Rivia set, the framework that Rivia set, which is completely different from what they've been used to. If they agree to this position, it's pretty simple for us to work together. And the clinics that we currently work with are small to medium-sized clinics. Typically, you're looking at 3 to 10 bed facilities. So these are primary care clinics. We take them to the Rivia process where we first take the facility to a certain level.
That was Isidore Kpotufe, CEO of Rivia, based in Accra, Ghana. That's today's Tech Report. Back to you, Esther.
Thanks, Paul. Be sure to join Paul Ndiho each Wednesday for the latest in technology on Africa 54.